Okay, again at this point, if you would like, you can use this hand lens to get a better look at anything that you were looking at before we do our final cleanup, right? So if you wanted to look at the optic nerve closer, right? You wanted to look at the retina closer, or the tapetum lucidum, whatever you wanted to look at, the iris and those ciliary muscles, okay, the lens, whatever it was. If you want to use this, okay, that is a tool that is available to you. I did not use it, but tweezers can help if you are trying to pull up the retina, okay, but again, I did not need them, but the tweezers were available should I have needed them. So now I'm ready for cleanup. So I have examined anything that I possibly wanted to. All of my tools that I used are sitting on this tray, okay? Now, what I'm going to do is take this bag that had the tissue, and I'm going to put all of the pieces of the eye, okay, in there. Now, I don't need to worry about picking up this vitreous humor. I'm going to do that. That's the first step, okay? And then I am going to kind of roll this bag, and then I'm going to seal it tightly, okay? All right, so that is the first step.